Hello.
Sorry.
All right. Good morning, everyone. Apologies for the delay in starting, just a few technical difficulties. So today's academic meeting will be presented by the Division of Pulmonology. Our speaker today is Dr. Erica Shaddock, who is a senior physician and senior pulmonologist at Wits and Charlotte Maxeke Johannesburg Academic Hospital. The interests include COPD, pneumonia, PCP, post-COVID lung disease, and is a very strong steward for antibiotic stewardship. So today, Erica will be talking about a very important topic, especially as we're seeing over 1,800% increase in the use of vaping among young adults. It's certainly without a doubt that we're going to see both short and long-term complications from this new form of inhalational substance use. Erica?
Thanks, Viv, and morning, everybody, and thanks for this opportunity. I want to make it very clear that the views you hear today are my views, and not necessarily the views of any particular university, society, etc. And this is quite important when it comes to vaping and e-cigarettes, because if you want to split a room and start a fist fight at a conference of pulmonologists, you bring up e-cigarettes. And hopefully we'll give you a bit of information today that will allow you to make a decision about which side of the fence you sit on. So, still having technical issues, but that might just be me. Oh, that's someone. Okay, not down. Okay. So at the beginning of November in 22, we saw quite a lot of very sensational headlines coming out in the press of some really impressive studies. This was the first that showed that more than 3 million middle and high school students in the US were reported using tobacco in 2022. So that's the headline, right? When you look into the nitty-gritty of that particular article, this amounted to 11% of all learners, so 1 in 10. And even though they used the word tobacco in the headline, e-cigarettes were the most commonly used tobacco product amongst the youth at 2.55 million. Okay. 3 days later, this report came out that more adolescent e-cigarette users report vaping within 5 minutes of waking up. And those of you who work in addiction will know that the amount of time it takes for you to wake up and then use your specific poison is a very good indication of how addicted one is to the particular product. And so the fact that these children had to use it within 5 minutes of waking up was a very important piece of information. If we digest that study a little bit deeper, there were just over 150,000 respondents, a good male-female split at about 50-50, with an average age of 14 and a half. So what do you think the confidence interval for that kind of thing would have been if our average age is 14 and a half? You know, obviously we're starting at a much younger age to get the spread.
Yes.
Well, I don't you can guess. So between 2014 and 2021, which was the 2 time points that these particular authors had used, they found that the age of initiation of e-cigarette use had decreased and the intensity of use and addiction had increased in those 7 years. And that by 2019, more e-cigarette users were acquiring their product within 5 minutes of waking in the morning. And then there's one sobering fact that they found that showed that many learners were completely unaware that there was nicotine in their e-cigarette. So where do I sit? Mostly on the fence of basic principles, which is to first do no harm. And I don't want to be a 1950s physician where I was promoting cigarettes because obviously they were the best cigarettes for you as your dentist. They made your cough less. These were the cigarettes that I recommended. And luckily back then, just over 20,000 physicians said that Luckies were less irritating. So I don't really want to be, you know, in this part of history, which is why I have done a little bit of extra research into these products. And the bottom line is that e-cigarettes came to market without any good data, showing any effect on smoking cessation. The product just arrived. And suddenly they were sold on this concept of harm reduction. And you'll see that a lot in the research. And protagonists of e-cigarettes bandy this term about a lot. And again, it's become the responsibility to demonstrate the safety and the harm of these products on the healthcare sector. Again, the cost has been ours to say, yes, they're good or yes, they're bad. And obviously the vaping companies are sitting back there making appropriate money. In 2014, so quite early on, there was a position statement from international respiratory societies. The South African Thoracic Society is one of them that joined this position statement. Prof. Richard van Zyl-Smit is our spokesman here. And I just want to highlight some of these points. So the health and safety claims regarding electronic nicotine delivery of devices should be subject to evidentiary review. The potential benefits of e-cigarettes to an individual smoker should be weighed against the potential harm to population of increased social acceptability of smoking and use of nicotine. These devices should be restricted or banned until more information about their safety is available, and they should be closely regulated as medicines or tobacco products. 2014. Unfortunately, very little of this happened. And I think the reason is that we were kind of congratulating ourselves. This is US data again. And if you look from 2000 to 2010, the top blue line is tobacco cigarettes or conventional cigarettes. Then we have cigars and smokeless or hookahs at the bottom. And we were doing a great job. This is the use of tobacco products in the youth, again in the US, where we came from just under 30% in 2000 to just over 15% in 2010. And obviously we were being quite congratulatory for ourselves and how well we were doing. And this is what we missed. And the light blue line there, and if you can look at that trajectory increase there, that was the e-cigarette use that was happening in the background. So yes, high school students were smoking less, but they had just switched their poison. So this is all obviously US data. What can we say about SA? This also came out around the same time as those CNN reports that I showed you, November 22, of a new crisis hitting schools in South Africa. This research is again from Prof. Richard van Zyl-Smit down in UCT, where he found that 1 in 4 matric learners were vaping. And 30% of these needed to use their vaping device within an hour of waking. And a quarter couldn't get through the school day without vaping. So I'm just wondering how these poor students are, hiding their vaping at school. So I just think it's important to look at how this all began and how we got here. And this is a little bit of a timeline, and I just want to highlight some of the points. So way back in 2000, the very progressive Supreme Court of the US ruled in favor of Williamson's tobacco, that tobacco products were beyond the scope of the FDA and therefore could not be controlled because they were not drugs or devices. So that was taken out of the FDA's control. Then again, with very good intentions, the e-cigarette was invented by a Chinese gentleman in 2003. And again, with good intentions. He had watched his father die of lung cancer and he wanted to find a better way to help people smoke less. And I don't know if he was because he was Chinese, but the FDA then decided in 2009, after they had started appearing in the US, that they would now ban all e-cigarettes and they were starting to be confiscated. But yet again, the Senate came in and said, you need FDA, you can't just ban these things, you have to have a proper regulatory policy. This is in 2012, I think. So again, the FDA was made redundant and they proposed a revised criteria about what constitutes a tobacco product. Then it was 2012 and the PAX laboratories induced their interpretation of e-cigarette, which was the Juul. And if anybody has watched the Netflix documentary called The Big Smoke, this is what this was all about. And obviously this is all going on in the background while the FDA is busy trying to do paperwork. And then they decide in 2016 that they will classify and extend the definition of these tobacco products. But in 2022, they postponed, this is 2017, they postponed the deadline for making a decision till 2022 because they thought it was appropriate to allow a balance between regulation and encouraging development of innovative new tobacco products. So they therefore, thought we'd put this on the back burner and we wouldn't have any rules. Then the dual market in the US, their market of the e-cigarette market was now 70%. A lot of people made a lot of money as the company was sold. 2019, the EVALI epidemic happened, and I'll get to that a bit later. The FDA releases guidance banning flavored cartridges and pod-based e-cigarettes. So that's 2019. And they then say that we struck the wrong balance on e-cigarettes in 2020. And just to add to this, this morning, if you read the BBC, there has been the US reverses the ban yesterday on the sale of dual products. So ban 2020 has been reversed again. So these products are now freely available in the US. So just a quick, in case you've been under a rock for the last 10 years, what is an e-cigarette or a vape? If only they looked like this, is what I must say. This is what the original device looked like. You have a liquid cartridge closest to the individual's mouth. You have a heating device, and then the lithium battery behind that, which obviously helps with the heating device. And as I said, if only they looked like this, because this is what they look like. And you can imagine for a high school student, the ability to hide something like this that looks like a pen or, a memory stick in their pocket makes these products particularly easy to hide. And they come in a world of flavors, okay? And it has taken the day of those of us who are a bit old, who when you used to go to a nightclub and you used to come home smoking like a smokestack, to now everybody smelling delightful. And again, making these products, less grotesque to a certain point. And the vaping industry has very clearly been targeting the youth. What grown-up 40-year-old gentleman or lady who has been a smoker all their lives, who now wants to quit smoking, needs a strawberry flavored device, needs something that smells like bubblegum. This is just not conducive to adult smoking cessation, which is obviously what the vaping industry. What is in e-cigarettes or vape? A nicotine, which we'll come back to. And there are lots of other ingredients. There are these ultrafine particles that obviously get inhaled to the lungs, the flavorants that I mentioned, which are often diacetyl, which we'll discuss a bit later, some volatile organic compounds, and heavy metals. And there was a recent study that came out to show that students who vape, regularly have a high urine content of a lot of heavy metals, whether that was uranium or lead or nickel. So these metals get inhaled because of the heating device and end up in the patient's bloodstream and eventually the urine. So then we have our e-liquid or juice, as it is referred to by the cool kids. So originally, there was the nicotine that was in the e-liquid, which is obviously the main point of this product, had concentrations of about 3 to 36 milligrams per mil. But then the very clever guys at PAX, who make Juul, found that if they ionize that nicotine, they could increase its solubility and could permit the e-liquids to have higher concentrations of dissolved nicotine. Their resulting aerosol suddenly was less harsh, and it shifted a lot to the normal profile and the inhalation reward time closer to a conventional cigarette. And just so that you know, that is how much nicotine is in a conventional cigarette if you smoke the whole cigarette. And now we could increase the amount of nicotine per mil in our e-juice to 50 milligrams. The other things that are in e-juice is the polyethylene glycol and the glycerine, which are carriers for the flavor and the nicotine. And these products are completely legal and are in food and other pharmaceuticals and are completely regarded as safe for ingestion. But research has shown that, especially polyethylene glycol, again, at high temperatures can alter the physiological processes that produce acute toxicity. And these are some of the breakdown products of polyethylene glycol and glycerol. And I just want to highlight a couple of them, that these are what people are inhaling into their lungs, occurring at high temperatures. I want to make that caveat, it's not always, but at high temperatures. And we have breakdown products like formaldehyde and acetone that are getting inhaled into individuals' lungs. Just a quick review of why nicotine makes us all feel so good. And that's because nicotine resembles the neurotransmitter acetylcholine. So the nicotine will attach to the neuron and then release it will then release dopamine, which then transfuses to the next neuron and causes that amazing feeling of pleasure and mood elevation, that whole concept of the runner's high. And nicotine is a highly addictive substance. And I don't think people take that, unfortunately, seriously enough. Because if we look at the 5 most addictive substances, we've got cocaine, alcohol, heroin, crystal meth, and nicotine. One of the 5 most addictive substances on the planet. And that's unfortunately what we are setting up the youth for, is a lifelong nicotine addiction. Just a bit of evidence on how we decide how addictive a substance is, as I mentioned to you guys, it was that how often or how quickly you need your hit in the morning after waking up. But another way to do that is to see how long it takes you to stop using the product. Another way of assessing addiction. So if we take the onset of dependence, so that's, again, when you need to use the vape in the morning, you can't go without it through the day, you'll get cravings. We use that as the start date. If we take it to the date of when half of the people who've used it are able to quit, that's what this particular study looked at. So we're going to take cocaine, which is in the red, and of all those who are addicted to cocaine, it takes 4 years for 50% of them to be able to quit their cocaine. And obviously this is people who want to quit. Marijuana takes 6 years, and that's in the orange. Alcohol, 16 years. Nicotine, 30. For 50% of people to quit their habit. It's nicotine in the adolescent that has become a massive issue in all of our lives in pulmonology. And that's maybe because, you know, adolescence is this incredibly important period of one's life. And it's the time when everybody is taking increased risks. We know this. And we can't change that behavior. This is an important part of, you know, growing up and learning to become independent and the transition to adulthood. So we can't look to change the increased risk-taking and the thrill-seeking behavior of the adolescent. That's normal. What we do need to do is make it more difficult for them to have access to products that would set them up for a lifetime of addiction. And this is why cigarettes are banned until 18. You know, people aren't allowed to vote or drive until they're older than 18, but somehow, you know, we think it's okay for them to make decisions about lifelong nicotine use. And if any of you guys ask your patients, when did they start smoking? The conversation always starts with, oh, when I was at school, hiding behind a particular building, or when I was in the army. That nobody, well, very few, so not nobody, but very few people tell you that at the age of 35, they suddenly decided to pick up a cigarette. This habit starts in adolescence. And this is obviously why. Because the adolescent teenage brain is impossible. I don't know if any of us would want to go back to being a teenager. You know, you've got hormones swirling everywhere. You don't actually, it's living in a haze. And now you're asking these young kids to make decisions about whether they want to use e-cigarettes. And very good data has shown that it's the prefrontal cortex, which is responsible for most executive functions and attention performance. And it's the last part of the brain to mature and develop. And that happens during adolescence. And if we put nicotine into that picture, these studies are obviously done with smoking, so I'm substituting the word smoking with nicotine, that during adolescence, you know, if you smoke during adolescence, you increase your risk of developing psychiatric disorders and cognitive impairment later in life. And adolescent smokers suffer from attention deficit, which gets worse with years of smoking. And nicotine is not harmless. Even the US Surgeon General reported that there was enough scientific literature on nicotine toxicity to conclude that at high enough doses, nicotine has acute toxicity. And there've been multiple cases of young children who find their parents' e-juice, who've drunk it, because obviously it tastes like bubblegum, strawberry, muffins, etc., and have died from acute nicotine toxicity. There's also multiple bits of data to show that nicotine activates multiple biological pathways through which smoking increases the risk of disease. And there are cancer, heart, and lung disease associations with nicotine. This is just a list of all the various tumors that have been associated not with smoking, but with nicotine as the tumor promoter. So it's definitely not harmless. Nicotine exposure during fetal development, obviously, which is a critical window for brain development, has lasting consequences on brain development. And it affects both fetal and maternal health, with very good evidence showing that there's increased risk of preterm delivery and stillbirth. But the largest harm from nicotine comes from its addictive properties. Now, I wouldn't be a pulmonologist without having to just harp on the respiratory effects of vaping. And I want to make it very clear, I don't have any data here to show you that you have a lower risk of developing COPD if you vape versus smoking. We don't have that data. You know, these things take 20, 40 years before they develop. So we cannot show you that. So all I can show you is what is occurring in the acute time periods. So this is some data, again, in adolescents. There's lots of data in adults, but I just wanted to harp on some adolescents for a while. The first survey is from Hong Kong, where they had a very good sample size of 45,000 adolescents who had used e-cigarettes in the previous month. And it was associated with an increased odds ratio of a reported chronic cough or phlegm, 2.1 odds ratio. So twice the chances of ending up with a chronic cough and phlegm. And obviously it's not good evidence, but, you know, if one was to extrapolate, there has to be some long-term consequences of that if you do that for 20 years. But again, I don't have the data. An American study with just 2,000 students, of whom 10% were e-cigarette users, found that they were 2 times likely to have increased chronic bronchitic symptoms. Quite recently, there was data showing increased risk of asthma in young people who vaped as well. I don't have that data here for you. Here's a Korean study with these were patients or students who had a self-reported diagnosis already of asthma by a physician the previous year. And there was increased use in those individuals of having used e-cigarettes. So, it doesn't mean that there's causation, obviously, we don't have enough data yet, but there is a suggestion that there is increased risk of asthma here. So now I'd like to do some myth busting or debunking. So the first myth, and this is what you'll hear from a lot of the students: I only vape with nicotine-free juice. Now, I couldn't possibly understand why one would do that, because isn't nicotine the whole reason one does vape? So I Googled it. Why would you vape without nicotine? And this was the list they came up with. So you get free of nicotine's toxicity. I can buy that. Nicotine breaks are non-addictive. Sure. You want to take a nicotine break, but you still want to vape. You want to satisfy a sweet tooth without guilt. Nicotine-free e-juice is often on clearance. And nicotine-free vapes are smoother, and I'll have more options. Now, I really don't think any of these are very good reasons to vape without nicotine. But if those are still your reasons and you think they're good, here are other reasons not to vape. So if we take nicotine out of the picture, these are still the injuries that occur with vaping. The device is known to explode. You have a lithium battery, you have heat, there's a solvent, these things happen. Okay, so if you had nicotine, no nicotine, these kind of things can still happen. Then just a brief note on EVALI. We all obviously love an acronym. So this is e-cigarette or vape-associated lung injury. Became a big problem just before COVID. So by the end of February 2020, there were 2,807 hospitalized cases of EVALI reported to the CDC. So obviously there were a whole lot that hadn't been reported, and there were 68 deaths. And this is what EVALI looked like, both in the ICU and on the CT scan and on the chest X-ray. Now, if that happened to me here now, I'm obviously going to treat the patient for pneumocystis pneumonia, probably. Then I'll worry about COVID and influenza. And EVALI is not necessarily going to be at the top of my list. But that is clearly what it looked like. And these patients had protracted periods of time on the ventilator. They did find out what the problem was. And that was because and again, the vaping industry will highlight this quite aggressively, that it was secondary to vitamin E acetate that had been illegally placed into what they're calling counterfeit cartridges, mostly with THC or the people who were using cannabis in their vaping products. So yes, this wasn't a regulated thing that was in the EVALI, that was in the juice, but it just shows you how easy it is to sneak something in to a product without regulation. And it was the youth who ended up bearing the consequences. Then a bit about popcorn lung, which can also occur even if you're not using nicotine in your vaping juice. And it's the diacetyl that causes popcorn lung. Originally described in workers who worked in the popcorn flavoring industry, so all the microwave popcorn we all use, they would be in the factories where those made. There were workers who would coming with this very unusual lung disease, and it's kind of like a hypersensitivity to diacetyl. So it's inhalation of diacetyl that causes popcorn lung in these factory workers. Now, this chemical is found in many e-cigarettes, and a lot of the vaping companies will say they don't use diacetyl. It is a completely legal chemical flavorant to be consumed via the GIT, and obviously not inhaled. And there was a lot of research recently that came out of Harvard that found that of the 51 e-cigarette brands they tested, 39 had diacetyl in it. But they also happened to find two other harmful chemicals, acetone and 2.3 pentadione. And at the end of the day, there was roughly 92% of all the e-cigarettes they tested had one of these three products in. So well, not all, 92% of e-cigarettes have the potential to cause popcorn lung, which is what this hypersensitivity type pneumonitis you're seeing. For me, this is the most important myth I would like to debunk here today, okay? And you'll see it everywhere. So they say that e-cigarettes are 95% less harmful than conventional cigarettes. Now, you would think that this piece of information comes with a whole bunch of research and evidence, because here it is on a vaping site, and their source is Public Health England. They sound like an important group of people. There's another vaping website where they underline, say, Public Health England says vaping is at least 95% less harmful. And this particular site has been exposed to 62 million smokers and vaping enthusiasts. So where is the vaping industry lying? No, they're not. This is a valid piece of information that came from this study, which is called Estimating, again, keyword, the harms of nicotine-containing products using an MCDA approach. So I just want to tell you a little bit about this particular publication. So this is a group of people, all those authors you see up there, one of whom happens to be South African, and quite a public South African. The group defined 12 products, all that were tobacco or nicotine containing, and they defined 14 harmful criteria. They took 7 criteria that they perceived as harms to the user and 7 perceivers harms for others or those around you. The group then sat around a table and scored all these products on each criteria for their average harm worldwide, using a scale of 0 for no harm to 100 for harmful. And the group also assessed relative weights of all the criteria to indicate their relative importance. So these are the 14 questions they assessed to users and to others. So product-specific morbidity and mortality, dependence, injury and crime, environmental damage, community cost. It does sound like quite a good study. But again, these are just a whole bunch of people sitting around a table, okay, thinking, how harmful do I think this product might be? And this is what they came up with. Here is cigarettes on the very far end, and ENDS is the e-cigarette. So they then took the cigarette as the 100% and subtracted it from the 5% that the ENDS came up with. And that's how they got their 95%. This was their conclusion or their interpretation of their results, was that cigarettes are a nicotine product causing by far the most harm to others in the world and themselves, and attempts to switch to non-combustible sources of nicotine should be encouraged. Now, you would think with such an important piece of data that, I don't know if anybody wants to try and guess how many references they were for the article. 29 references for this article. 2 were about e-cigarettes, all right? And they were called Safety Evaluation Risk Assessment, which is number 29, and Achieving Appropriate Regulations on E-Cigarettes at 25. Those are the 2 references. And I've highlighted the editor note that is hidden over there that says the editors are aware that one of the authors has connections with a company that is associated with one of the largest tobacco industries in the world, British American Tobacco, and would like to notice that this standalone company produces e-cigarettes. And this is being regarded as a new form of nicotine replacement therapy. But somehow the scientific community has to discuss the demarcation between potential conflicts of interest. Now, I'm not sure what a big conflict of interest if one of your main authors on the particular study is, making e-cigarettes. But this study from 2014 has been latched onto by the vaping industry, and you will see it everywhere. No evidence, okay? They did not take a sample size and compare e-cigarettes to vaping. They just sat around a table. Somebody did pick this up. This was in 2015. The BMJ did make a comment about what was this evidence for e-cigarettes harmlessness being based on. And then it got a little bit swept under the carpet again. And in 2020, again, another group of article again brought to the front of the invalidity of this often cited estimated decrease in relative harm of electronic cigarettes. And again, as I said, this is what they concluded. And at the very end of the study, in the discussion section, at the end, it says a limitation of this study is the lack of hard evidence on the harms of most products on most of the criteria. And Public Health England and the Royal College of Physicians decided to run with it anyway. And why is this? And the bottom line is the tobacco industry. This is one of the most profitable industries in the world. It's estimated that legal tobacco sales are worth about 605 billion per year. And we know what the taxman does to cigarettes. So there's a large portion of tax revenue that comes from the tobacco industry all across the world. And as we started with, the very first thing we found was that Williamson's Tobacco convinced the Supreme Court in the US to unclassify cigarettes as being controllable by the FDA. This industry has a massive amount of power. But then the next thing you'll say to me is, oh, but that's the tobacco industry. That's the people who make cigarettes. These are the vaping companies that the tobacco industry owns. So we've got Imperial Brands, Philip Morris, Japan International Tobacco, and then British American Tobacco, which is the one industry we've talked about before. And all of these cigarette companies own e-cigarette companies as well. In fact, Juul was bought out by a large tobacco company many years ago. Now, if you were to say, Google on the internet and say, I'd really like to quit smoking, this is the kind of stuff that would come up. And it really does look very festive. It's called Unsmoke South Africa. You know, if you don't smoke, don't start. If you smoke, quit. And if you don't quit, change. And then obviously all of these very happy other posts that come up with it. It's very flashy. This is something else you'll see from the Foundation of a Smoke-Free World. They are talking about the E-Valley outbreak and how it had nothing to do with the vaping industry. It was a completely illegal contaminant that occurred, and that it's being misinterpreted is what all of this is, as being a vaping problem. The same Foundation for Smoke-Free World, if you go a bit further down, they give you their mission statement, their vision, and who they are. The foundation is funded by annual gifts from PMI Global Services. The foundation is independent of PMI and operates in a manner that ensures independence. Who is PMI? Philip Morris Tobacco International. And these guys are behind all the vaping, or the pro-vaping companies. The tobacco industry knew I showed you, we had lost all those young people who were now not smoking anymore. They needed to find another way to make money. So just some latest research, and I'll try and be a bit more balanced, just to show you some other side of the coin. This is from February, the NEJM, Electronic Nicotine Delivery Systems for Smoking Cessation. This was an open-labeled randomized controlled trial, which randomly found adult smokers who wanted to quit, and that is very important. We all know that there's no point trying to ask somebody to stop smoking if they don't want to. And these adults were prepared to set a quit date. And they had two groups. They had the intervention group, who received free e-cigarettes and e-liquids, and then standard of care smoking cessation counseling, and optional but not free nicotine replacement therapy. I'm not sure if our ethics committee would have allowed any of that through. The control group received standard counseling, obviously about stopping smoking, and a voucher, so again, money of some sort, which they could do with whatever they wanted, and that could include getting nicotine replacement therapy. When we talk about nicotine replacement therapy, we're talking about patches, gum, anything along those lines, spray. So those are our two groups, published in the NEJM. Their conclusion, well, and I'm going to give you the conclusion before I show you the results, showed the addition of e-cigarettes to standard smoking cessation counseling resulted in greater abstinence from tobacco use among smokers than smoking cessation counseling alone. So that's what the conclusion was. Here are their results. So their primary outcome was continuous abstinence from smoking at 6 months. And in the intervention group, 28.9% of the participants were not smoking at the end of 6 months. And in the control group, that was 16.3, which gave you a relative risk of 1.71. These are all their weird secondary outcomes, which have to do with whether they validated whether the person was biochemically, whether the patient was smoking or not. You know, they're interesting, but I don't necessarily think we want to spend time on them. I want to focus on that primary outcome. So yes, the primary outcome shows that using e-cigarettes that were paid for and given to you are going to prevent you from smoking cigarettes more likely than just counseling alone. 28.9 versus 16.3. This is table 2, where they found that no tobacco cigarettes, the intervention group, well, there was, so this is kind of flipping it the other way around. There was 59.6 people did not use tobacco cigarettes in the intervention group versus 38.5 in the control group. Right, that again sounds impressive. Here we have no tobacco cigarettes or e-cigarettes. So people are not using tobacco or e-cigarettes. And this is where the flip comes. So in the control group, we're sitting at 35.5, very close to that 38.5 we had earlier with no cigarette smoking. In the intervention group, you're sitting at 11.2, okay? People had just switched one habit for another. That's all that happened here, okay? So yes, at 6 months, you changed your nicotine dependence from requiring a cigarette to an e-cigarette. And those that are pro harm reduction would say, well, that's okay because they're not smoking cigarettes. But it's one poison for another. And that piece of information does not get translated into conclusions for these particular studies. These are the no nicotine or nicotine abstainers, because obviously people in the control group may have still been using nicotine patches, okay? And there we've again got 33.7 in the control group versus 20.1 in the intervention group. So still way more in the control group. So if you give people good smoking counseling and just nicotine and some nicotine patches and some support, you can get them to stop smoking without handing them a vape that they're now going to be addicted to. This is the editorial that came with this. I didn't type it out, but you would think that which way is this going to go? But this editorial decided that e-cigarettes were definitely part of our new toolbox and definitely part of cessation, smoking cessation devices, and that they should be prescribed and recommended. So that's what the NEJM editorial thinks. This is from Nature Medicine, another group of authors. I just want to point out that the same author is on this paper as the editorial before, so not necessarily a different opinion, just a different article published in a different journal, which showed that for a person who smokes tobacco, recommendations about how to use e-cigarettes for smoking cessation. If using e-cigarettes to quit smoking, a person should switch completely to e-cigarettes, use them regularly, and stop smoking all cigarettes as soon as possible. We do know that dual use is even worse than one or the other, and very pro e-cigarettes. The NHS or Public Health England. This is on the website. They come up with this caveat at the bottom that says vaping is not completely harmless. We only recommend it for adult smokers. They have their own myth debunking here, where they say nicotine vaping is not risk-free, but is substantially less harmful than smoking. Again, using that 95% data I told you about earlier. Nicotine is very harmful to health. NHS website. Although nicotine is addictive, it's relatively harmless to health. I showed you some evidence to show how dangerous nicotine is, but not all. But this is what they are putting on their website. Vaping does not help people quit smoking. They're saying it does. I showed you it did. It definitely helps you quit smoking, but you obviously still are using a nicotine product. There was some, oh no, I'll show you the next one. Switching to a vape is just swapping one harmful addiction for another. And then they say, you know, the same thing, that vaping nicotine is less harmful, which I think is not true. Patients use vapes more frequently than cigarettes. That must be worse. And then they talk about, yes, that is what happens. You do puff more or vape regularly on your vape. And then they use terminology like, with vaping, generally it takes longer for the nicotine to reach the brain, and you need to sip on your vape more frequently. And I just find that a lot of the terminology used on the site is just making, you know, vaping seem normal and acceptable. So what am I doing? I'm going back to first principles, especially with regards to first do no harm. And I think there's a lot to say for the fact that by normalizing vaping for the adult smoker, we have just resulted in an addiction for a large amount of the youth, who will obviously use that and progress into their adulthood and a lifelong addiction to nicotine. And I don't think I can stand by a product that does that. And I'm happy to take any questions.